welcome back to my YouTube channel. Today we are going to talk about Norma Frontalis. Start our topic with introduction. Norma Frontalis refers to the anterior view of skull, showing the facial bone and frontal aspect of cranium. This view is essential in anatomical studies, medical imaging, and forensic identification, providing a comprehensive understanding of facial symmetry and skeletal structures. Norma frontalis is the frontal perspective of the skull, allowing examination of the facial proportion and bone alignment. It is crucial in dental, surgical, and forensic application for analyzing structural variation, fractures, or deformities. Now let's talk about what are the bones visible in Norma frontalis. Scapular bone contribute the frontal view of the skull, forming the facial framework and cranium. They include frontal bone, zygomatic bone, nasal bone, maxilla, and mandible. First, we'll start with the frontal bone. Frontal bone forms the forehead and upper part of the orbits that are eye sockets. Its feature includes supraorbital foramen that allow passage for nerves and blood vessels. Next bone we are going to talk about is zygomatic bone, that is also called as cheekbone. There you can see the green bone is zygomatic bone. It is located on both sides and it defines the facial contour. It articulates with the temporal bone, frontal bone, and maxillary bone. Next bone we are going to talk about is nasal bone. It forms a bridge of nose connecting the maxilla and it provides attachment site for nasal cartilage. Next bone is maxilla. It houses the upper teeth and forms part of orbit and hard palate. It contains the infraorbital foramen allowing passage for nerves. Next bone we have is mandible, that is also called as lower jaw bone. It is only movable skull bone and its features include mental foramen which allow nerve passage. Next we have is orbital cavities that houses the eyes formed by frontal bone, maxilla bone, zygomatic bone, sphenoid bone, ethmoid bone, lacrimal bone, and palatine bone. So these are the 7 bones that form the orbital cavity. They protect ocular structures and provide attachment for muscles. Now let's talk about the key features of Norma frontalis. The first key feature is glabella. That is basically the smooth area between the eyebrows. The next feature is nasion, that is point where the frontal and nasal bone meet is called as nasion. The next feature of Norma frontalis is ventral protuberance, that is basically chin protuberance or chin prominence. Next feature includes intraorbital distance, that is distance between both orbits, and it is important in forensic analysis. Now let's talk about the clinical and surgical application of Norma frontalis. Norma frontalis is used in facial reconstruction and orthodontic surgery. It is essential in forensic anthropology to determine individual identity. It helps in analyzing the congenital anomalies and traumatic injuries. Now let's talk about the conclusion and endpoint. Norma frontalis provides vital anatomical details, facilitating studies in medicine, surgery, and forensic sciences. Understanding this skull view helps in diagnosing condition, planning treatment, and identifying facial proportion. So this was all about Norma frontalis. Hopefully you liked the video. If you do, don't forget to like, share, subscribe, and comment.